Good afternoon. My name is Donna Feazell, and I'm your host of The Edge on IC Radio, your source for news and entertainment. You can also find us on television channel 182 on Charter Communications and Abundance Television, which is found on Roku, Apple TV, and Amazon Fire. Thank you so much for watching every day, Monday through Friday, as we get to sit down and talk with each other and have a little chat. Always encourage you to send emails and appreciate you doing that. So Edith had sent an email to me, and she wanted me to talk about anxiety. Said she had some family members she suspected were suffering from anxiety, and just wanted me to do some research on that. You can also send an email to donna@donnasedge.com. That's donna@donnasedge.com. I'll be happy to go out and do that for you, because I mean, you're the reason I have the show, and you're the reason that we have the topics we have. So dealing with anxiety, send an email for anything you would like for me to cover. I'll be glad to do that for you. So we had part one. This is part two of the show, and it's anxiety symptoms and signs to look out for. We talked about on this past show the symptoms of anxiety, and I want to go over that just one more time. And that's constant fear that something bad is going to happen. Could be difficult sleeping, dizziness, excessive worrying, irritability, rapid heartbeat, restlessness, sweating, muscle tension, and the list goes on. Then we have generalized anxiety symptoms. And I wanted to talk to you about that just for a minute. Let's go ahead and click on this link. By the way, this is a very good website, choosingtherapy.com. Choosingtherapy.com. If you're suffering through anxiety, I'm begging you, go on ahead and talk to somebody, a very professional, possibly a Christian-based type therapist. Dr. Don Brock is in our area, in the Fort Payne area. I think he, say the Fort Payne or Mentone, but I know he's a good guy. I've met him on several occasions, and he's a real good guy. He's a minister, and that's how I know him. But anyway, he's just a super nice guy. So generalized anxiety disorder and symptoms, the signs and the treatment. Now, of course, there's, it's called GAD, generalized anxiety disorder, is an anxiety disorder that's marked by regular excessive anxiety that gets in the way of someone's quality of life or their ability to function. So GAD symptoms arise in response to several different situations, sometimes even when there is no identifiable cause. GAD is relatively common, affecting about 3% of the American population. So what is generalized anxiety disorder? People with generalized anxiety disorder, GAD, worry excessively about many different situations, and sometimes that being able to identify what they're anxious about. In addition to excessive worrying, people with GAD often also experience restlessness, fatigue, tension, irritability, and may even have trouble sleeping and concentrating. So how common is GAD? Generalized anxiety disorder is a type of anxiety that affects 5 to 7% of adults in the U.S. at some point in their lives. So what is the difference between GAD and just plain old normal stress? Because everybody has normal stress, right? So stress and anxiety are often experienced together with many overlapping symptoms, including a racing heart, muscle tension, irritability, and worried thoughts. While these symptoms are normal in unfamiliar, stressful, or scary situations, people with GAD experience anxiety that is excessive and it's frequent. Their symptoms occur most days of the week and persist for at least 6 months, as opposed to only being experienced during times of stress. Everybody gets stressed. I'll go on ahead and give you the same situation I gave you in the first edition of this show, and that's when a tornado warning is coming. We're in Tornado Alley. A lot of folks get anxiety when there's a tornado warning out, because again, Tornado Alley, we've had a lot of destruction when tornadoes and even just thunderstorms can arise here, because we can have the winds that are so excessive. I know a lot of people have lost their houses. There are folks who have lost loved ones. So it is a time that a lot of folks do get anxious. Now, their symptoms occur most days of the week and persist for at least 6 months. Still, people with this disorder often find their symptoms worsen during times of stress. Now, you can always find help with this particular situation. I just mentioned one in this area. His name is Dr. John Brock. And he's not even paying me to say this. He's just a good man, very good man. Generalized anxiety disorder symptoms. Only a licensed and trained health or mental health professional can diagnose GAD. Now, all mental health conditions, including GAD, are diagnosed using a standardized set of criteria drawn from the Diagnostic and Statistical Manual of Mental Disorders. Now, symptoms of generalized anxiety disorder include excessive anxiety and worry about a number of events or activities occurring more days than not for at least 6 months. The individual finds it difficult to control the worry. Maybe family members will say, well, quit worrying about that. They can't quit. The anxiety and worry are associated with 3 or more of the following symptoms, and only one of these in children. So restlessness, feeling all keyed up or on edge, becoming easily fatigued, difficulty concentrating, or mind just goes blank, irritability, muscle tension, difficulty falling asleep or staying asleep, or feeling tired after sleep. Now, the anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Now, the disturbance is not to be attributable to the psychological effects of a substance or other medical condition. The disturbance is not better explained by another mental disorder. Now, let's talk about GAD symptoms in children and teens, and let's just see how similar this is. So GAD signs and symptoms in children are relatively, in teens, are relatively the same as in adults. What changes is what they worry about and how the symptoms may present. Now, kids with GAD tend to worry about things typical for their age. However, their worries and apprehensions are recurrent. They're intense, hard to shake off, affecting their ability to focus, relax, and enjoy activities. Now, common signs of GAD in children and teens include getting easily irritable or unhappy for no apparent reason, having difficulty coping with uncertainty or indecisiveness, expecting the worst without a valid explanation, tendency to over-worry about catastrophic events like earthquakes or maybe nuclear war. They're watching a lot of the news. We've got to be careful what our kids watch. Seeking constant reassurance, feelings of insecurity regarding performance, which may manifest in being perfectionist, tendencies like having to redo tasks, obsessing about punctuality, becoming easily tired, particularly at the end of the day, inability to concentrate or feeling like their mind is just going blank, restfulness, feeling keyed up or on edge, they have trouble sleeping, experiencing physical issues like headaches, upset stomach, muscle soreness, trembling, twitching, etc. Now, the signs of generalized anxiety disorder. Now, GAD is a disorder within the category of anxiety disorders. Like all anxiety disorders, the condition causes people to experience excessive anxiety. Anxiety describes a collection of symptoms that include changes in the way a person feels, thinks, and behaves. Now, changes in feelings, thoughts, and behavior. While all people experience occasional anxiety in specific stressful situations referred to as situational anxiety, people with GAD experience anxiety that is frequent and disappropriate. People with GAD often experience more intense anxiety in situations where there's a lot of uncertainty, or maybe when they're just not in control. They may not be able to identify a specific fear during these times and might instead describe just feeling a general sense of dread. Some people also describe feeling more irritable or snappy during times when they are anxious. Panic attacks. People with GAD experience anxiety as panic attacks, which are intense symptoms of anxiety that come on suddenly and typically last for several minutes. Someone having a panic attack often describes their heart as racing or that they have chest pain and experience shortness of breath. Some people might experience dizziness or even pass out during a panic attack. Many times people confuse panic attacks with heart attacks or other medical emergencies and end up seeking emergency care. They worry and have trouble concentrating. People with GAD may spend a lot of time worrying just about bad things that could happen, even when these are highly unlikely to occur. Because of these changes in thinking, people with GAD often describe having trouble focusing and concentrating. Worried thoughts might keep them up at night, and insomnia is frequently reported. Avoidance. Because anxiety is uncomfortable, people with GAD may avoid certain situations that cause them even more anxiety. As a result, they might become more socially isolated, less active, and give up activities that they used to enjoy. Because anxiety tends to be more intense in unfamiliar or uncertain situations, people with GAD might have set routines that they are hesitant to deviate from. While avoidance of tasks and situations is common, there are some people who cope with GAD symptoms by staying very active and busy, distracting themselves from anxious thoughts or feeling. Now, what causes generalized anxiety disorder? A number of different brain chemicals are thought to play a role in anxiety, and people with GAD may have imbalances that help to explain some of their symptoms. Serotonin is a primary chemical that can tend to be imbalanced in people with GAD. It's believed that anxiety disorders, including GAD, are largely a result of an overactive, I'm not sure, I may be butchering up this word, I'll just spell it for you, AMYGDALA. That's a region of the brain that helps detect danger. So when this particular part of the brain is overactive, it triggers the release of certain chemicals, and that activates the nervous system in ways that cause an increase in heart rate and respiration, along with other changes that make up the fight or the flight response. Let's go into a commercial break, and when we come back, we're going to be talking about the risk factors for developing GAD and the complications of living with GAD. We'll be right back in just a minute.
At Lamone's Mexican Restaurant, located in Henniger, Alabama, and voted Best Mexican Restaurant of DeKalb County, Alabama 2020, we're here to serve you with authentic Mexican cuisine. Order easily online by going to lamonsmex.com or call 256-657-3999 to place your order. We're open Sunday through Thursday, 11 a.m. to 9 p.m. and Friday and Saturday, 11 a.m. to 10 p.m. Whether you're celebrating a cozy date night for two or a celebration for a crowd, at Lamone's you'll love our atmosphere and friendly servers. Thank you for dining with Lamone's Mexican Restaurant. At Liberty Bank, we're all about community, whether it's to help with a charity fundraiser or help families in need. Toys at Christmas or a local football team, we're here for you. You see, we realize the importance of family. Sometimes it's to build a new home or necessary home repairs. We're here for you. If you like the feel of a small town bank with all the conveniences of a big city bank, we're here to serve you. You will find us at any of our convenient locations in DeKalb, Marshall, Etowah, and Blount counties in North Alabama. You can call and speak with any of our friendly staff at 256-659-2175 or check us out on the web at libertybankal.com. And thank you for your support of our community. Member FDIC Equal Housing Lender. Let Rhonda at Rhonda's Elite Tax LLC take the burden off you for all your tax needs. I know because Rhonda has been taking care of my business since 2013. I feel Rhonda works for me because she knows the direct questions to ask to better benefit my unique business in order for me to get back the biggest refund possible. Rhonda is an ongoing student, and she knows tax laws are in a constant change every year. Call 256-281-9903 for an appointment to take the dread out of getting your taxes done. Rhonda is located at 11968 U.S. Highway 431 in Boaz. Again, that number is 256-281-9903. And let Rhonda's Elite Tax LLC champion your personal and business taxes.
Jeff McCurdy of the McCurdy Law Firm has been a public service of this area for over 10 years. McCurdy, a member of the Henniger City Council, serves as prosecutor for the town of Sylvania and was named public defender for the city of Rainsville. The McCurdy Law Firm is located at 17326 Alabama Highway 75 in Henniger to better represent his Jackson and DeKalb County clients. If you need to be represented by a true public servant with proven success, call Jeff at 256-996-8701 or send a private email to mccurdylawfirm@gmail.com. No representation is made that the legal services performed is greater than the legal services performed by other lawyers.
The Hatter Cafe and Country Inn is nestled in the northeast corner of Alabama the Beautiful in the delightful town of Mentone. We're located on top of scenic Lookout Mountain near Little River and DeSoto State Park and located only 5 minutes from shopping and restaurants. There is also a nearby community walking path and golf course. We welcome everyone through the doors and we are committed to outstanding service for all guests. At the Hatter Cafe and Country Inn, we invite people from all walks of life to come and get away from it all, enjoy the open spaces, treetop views, fresh, clean air, and experience Southern hospitality at its finest. We look forward to hosting you. To reserve a special event, or if you would love a special getaway at the Country Inn, you can call us at 256-634-2018.
Are you ready?
We all wonder what tomorrow will bring, but the future lays itself at the feet of the prepared and surrenders to the will of the persistent. It's not easy, but today shapes you so you can shape tomorrow. With Northeast Alabama Community College, when the future asks if you're ready, you can answer.
Yes.
Begin your future at Northeast Alabama Community
Okay,
College.
we're back. My name is Donna, and I am your host of The Edge on IC Radio, your source for news and entertainment. You can find us on television, channel 182 on Charter Communications and Abundant Television, which is found on Roku, Apple TV, and Amazon Fire. Thank you so much for watching The Edge. We definitely appreciate it. If you would like for me to cover a topic, a specific topic for you, I'll be happy to do that. You can send an email to donna@donnasedge.com. And I'll be happy, more than happy, to go ahead and do that research for you and put together a show for you. This one is coming from Edith, and Edith wanted me to talk to you. And this is from a website called choosingtherapy.com. She said that she feels that she has a family member who may be suffering from anxiety. And a lot of people are these days. It kind of got triggered when COVID hit too. A lot of young people are going through anxiety like this. Okay, so we're going to talk about the risk factors for developing GAD. Now, all mental health conditions are caused by a complex interaction of genetic, biological, social, psychological, and environmental factors. People who have a family member with a disorder are 25% more likely to develop GAD, as are people diagnosed with other medical or mental health conditions like depression. So people who abuse substances are also at higher risk, and as are those who experience something stressful or traumatic at some point in their lives, especially during childhood. A lot of folks who came from unhappy homes go through situations. I know My brother, sister, and I all three go through some issues that happen because of the family life we had. Well, while not casual, some people may be at higher risk for developing GAD than others. Those who are more likely to develop GAD include females, unmarried adults, people who have low levels of education, people under greater levels of stress, and people who are in poor physical health. Now, complications of living with GAD, let's talk about that for just a few minutes. So GAD can be extremely debilitating and is usually linked to a variety of negative life outcomes. When left untreated, complications can lead to or aggravate other mental and or physical health conditions impacting important areas of functioning. So let's talk about those complications. It can lead to poor job performance and increased absenteeism, inability to efficiently tend to personal responsibilities. They can have sleep issues like insomnia, increased use of medical resources. They can go through chronic depression, substance or alcohol misuse, health problems such as irritable bowel syndrome, health disease, ongoing headaches, and more. There may even be social withdrawal, increased suicidal thoughts and behaviors. So when should I see my doctor? If any of these symptoms and or complications discussed resonate with you, it's a good idea to talk with your doctor about how you're feeling. So your PCP can evaluate you for any underlying medical conditions that may account for your symptoms or refer you to a mental health specialist. The earlier you get treatment for GAD, the better, because when left untreated, your overall wellness may be at risk. So how is GAD treated? GAD symptoms can get in the way of living a full, happy, and productive life. Luckily, GAD is highly treatable, and many people who receive treatment can significantly reduce and in some cases even resolve their symptoms. Treatment options for anxiety include psychotherapy, medication, could be a combination of both. And let's talk about therapy. There are several different types of therapy that counselors may use to treat anxiety disorders. Some types of therapy have been more extensively researched than others, resulting in more evidence supporting their efficacy. Currently, the gold standard, that's in quotes, in treating anxiety disorders is cognitive behavioral therapy, which is CBT. Other therapy options for GAD may include exposure therapy and acceptance and commitment therapy, ACT. Now let's talk about medication. Sometimes anxiety medication is recommended for people with GAD as part of their treatment. Medication is usually provided by a psychiatrist, psychiatric nurse practitioner, or physician's assistant who specializes in behavioral health. On occasion, general practitioners may also prescribe anxiety medications for their patients. Some of these common medications used to treat anxiety include, and I'm going to spell this for you because I don't want to butcher this up, benzodiazepines, I think is how you pronounce it. It's benzodiazepines or beta blockers, which both work to reverse certain stress-related nervous symptom functions. Now, how to get help for GAD. If you or someone you care about is struggling with anxiety related to GAD, the good news is there are many effective treatment options that can help people reduce their symptoms and improve their overall quality of life. Often anxiety disorders respond very well to therapy, so finding a counselor is the first step to take. There are many ways to find a certified therapist, but an online therapist directory is a great place to start. If you're in my area, Dr. Don Brock, B-R-O-C-K, would be a good thought for you right there. Whether you're in DeKalb or Jackson or Marshall County, whatever, that's a good start. Now, if you are outside my area, go to this website, choosingtherapy.com. choosingtherapy.com, and they have a link you can click, and it's online therapist directory. And what you'll do is just type in your zip code or maybe even your address, and you'll be able to find someone that way. Now, some people can also choose to talk to a doctor or psychiatrist about medication in addition to therapy. Both therapy and medication consultants with doctors are usually covered by most health insurance plans, which make it easier and more affordable for people to get help with their anxiety. So let's talk about 5 ways to cope with GAD symptoms. Anxiety is uncomfortable, and living with symptoms of GAD can make it hard to function normally. Those suffering from GAD should consider seeking formal treatment, which can help reduce symptoms and teach skills for improved coping. In addition to treatment, there may also be lifestyle changes and skills that could help to manage and reduce GAD symptoms. Now, there are 5 ways to cope with GAD symptoms, and let's cover those before we have to leave today. Maintaining an active lifestyle. That's number 1. An active lifestyle, which includes regular exercise, can help to balance the brain chemicals and stress hormones linked to anxiety. I just have found that when I exercise, even if it's only for 5 minutes a day, it helps to clear my mind. And that helps us all. As we get older, we start having memory losses and that kind of thing. So it's just a good thing to stay active. Exercise, if it's nothing but doing 5 push-ups a day, that's some exercise. Establishing a meditation practice. Meditation practices can also help anxious people focus their attention on the present moment. Or some of us might call it prayer. And getting unhooked from unhelpful thoughts that feed into their anxiety. Developing more self-compassion. Self-kindness, forgiveness, and acceptance is key to mental health, and exercises focused on building self-compassion can help to reduce stress and anxiety. I feel like a lot of anxiety and stress comes from so many years and so many decades of us having the me generation, where it's just all about me. We don't think of anybody else. And I think that brings on a lot of stress. Also, number 4, managing stress levels. Managing stress requires basic self-care and healthy lifestyle choices like eating well and sleeping enough, and involves working to directly address sources of stress. Could be just plain old getting an herb, something that makes you sleep, might help you out as well. Let's see. Number 5 could be relying on social supports. Having a support system, even if it's a very small one, is key to mental wellness. Fostering and maintaining close relationships with other people can help to minimize stress and provide comfort during times when GAD symptoms are most intense. Now, can GAD be prevented? Because there isn't a specific cause for GAD, it's difficult to prevent. Nonetheless, if you think you're at risk of developing GAD, or if you feel like you're getting more nervous than usual, there are things you can do to diminish your anxiety. You can begin by leading a healthy lifestyle and avoid limiting the consumption of caffeinated and alcoholic beverages. You can also address any emerging symptoms with therapy sooner rather than later, which can prevent GAD from worsening. So professional treatment is known to have a favorable outcome and enhance quality of life for people living with anxiety disorder like GAD. My name is Donna, and I am your host of The Edge on IC Radio, your source for news and entertainment. You can also find us on television, channel 182 on Charter Communications, and Abundance Television, which is found on Roku, Apple TV, and Amazon Fire. If you have suggestions and you would like for me to cover a specific topic, all you've got to do, very simple, send an email to donna@donnasedge.com. That's donna@donnasedge.com. I'll be more than glad to cover that situation for you. Again, thank you so much for watching.